We have answered all the questions. There's nothing else to consider at this point. Just a couple closing comments before we wrap it up from here. I've learned a lot. Part of the reason I wanted to have a discussion, because I've been having a hard time myself trying to answer this question, articulate that. I figured I would just listen to them and transcribe it and then go from there. Is it knowledge? It's obviously not knowledge. The computer has knowledge. It can beat you at that any time of the day. Is it empathy? Is it being nice? You could do that. That's important. But there are a lot of nurses that are very nice and empathetic. An actor can be empathetic. A golden retriever is probably nicer to a patient than half the doctors I know. So just attach an AI talk box to the golden retriever and that makes a doctor? I don't think so. That is laughable. That doesn't make sense. Maybe we're here just to assume liability, to double check that message so the patient has somebody to sue if something goes wrong. That's kind of how things are right now. I actually think it's not any of these things. It's all of these. It's not just knowledge. It's also judgment. That was raised, right? Two things can both be true. The patient has kidney failure and they have heart failure. What do you do about it? Should you give the diuretics or not? The chemotherapy will work and you will live 2 months longer, but you will have terrible side effects for those 2 months. Should you do that? That's not a question of knowledge or facts. The textbooks do not answer those questions. You have to have judgment. You have to understand your patient. It's not just empathy. It is negotiation. I've told my trainees, you've probably heard this, anybody can write the prescription. The real skill is, can you make somebody do what you want them to do? It doesn't matter if you prescribe the medicine, the patient doesn't want to take it. It doesn't matter if the surgeon won't go to the OR. It doesn't matter if the insurance company won't pay for the procedure. And it's not just liability. Imagine this, big tech company, use our AI system, it's gonna take care of your patients. Don't worry, we have an insurance company who will pay you if anything bad happens. Would you feel good about that? It might be better than the current state of the world where they have like no liability at all. I don't think you would feel good about that. You want someone to take personal responsibility, right? This professionalism to be your direct advocate in your situation. And by the way, that person has to have knowledge, otherwise that responsibility means nothing. I take responsibility for building your house. I have no idea how to do that, but I will be responsible. It means nothing. So I actually think it is all of these things combined and integrated into a single person or perhaps a single entity. Any one alone is really unsatisfactory. Party thought. Okay, what was I gonna say? You know, Arthur C. Clarke famously once said, any technology sufficiently advanced is indistinguishable from magic. But it's not magic. It's not magic. Algorithms, advanced algorithms applied in a very deliberate manner. Warner Slack famously riffed off of Arthur C. Clarke when he said, any doctor who could be replaced by a computer should be replaced by a computer. Many people misinterpret this statement. They think this is advocating for replacement. This is actually saying the exact opposite. Any good human you cannot replace with a computer, no matter how good the computers get, because you provide a very different and specific value, and we should train our people to understand that and retrain them to understand that. And by the way, when we're drowning in mountains of paperwork and there are patients on 6 to 9 month waiting lists, even at Stanford to be seen by specialists, let alone the billions of people worldwide and tens of millions of Americans, you know what, please, we need some AI in here. We should hope, we should dream, we should beg to get some AI in here because we need some help. Having said that, Kurt is still here, but others might say, AI is not gonna replace anybody. Those who learn how to use it may very well replace those who do not. So I'm very glad we're having this symposium. I have a feeling it won't be the last one because there's a lot more to do and to learn. And we should be thinking about the cutting edge, the state of the art, not just in terms of developing technology, we're doing that too here, but also how do we train and retrain an entire generation of the healthcare workforce so we can reach all of the patients who need us. Thank you all so much for coming. Looking forward to a fantastic reception. Let's continue the conversation outside. And if all the speakers, presenters, and all the people behind the scenes, I know you're there, could come on, join us. We're going to take a picture and to acknowledge all the hard work. Thank you all so much. See you in the session.